Madam Clerk, are we good? We're going to go ahead and start this afternoon's session. So we're coming out of recess for our continuing budget talks and functional area discussions today on Health and Human Services. Prior to us beginning this session, we have an opportunity for public comment, and I believe a few individuals have signed in. Madam Clerk.
Yes, Mr. Chair. The first speaker is Dr. Jacqueline Chisholm. Ms. Chisholm, if you'll hit the button.
There we are. Good afternoon. Thank you for this opportunity to speak. I am here on behalf of the Council for Economic Opportunity in Greater Cleveland. We are the oldest Head Start program in the state. We are also the largest. We are also the oldest community action agency in the state of Ohio. We know that this afternoon you're going to entertain the conversation about early childhood and Invest in Cleveland. I am here simply to say that we, of course, believe in the work of Invest in Cleveland or Invest in Children, but we also want to make certain that we're at the table. I think too often what happens is the conversations take place. Some of the people who've been doing this for a long time, we've been doing it for 50 years. Matter of fact, when we started Head Start in 1965, we were the only agency that received federal dollars for Head Start. Everything else was a delegate of ours, including the Center for Families and Children, Catholic Charities. So we have expertise that we believe will be important to that discussion. So I'm not going to take up a lot of time just to simply say that we're here. A number of us have been doing this, and we believe that the opportunity that you have before you with the dollars that I think you're going to discuss at some point is how do we expand that? How do we help the people who are already doing this work do it better? But the questions that we also have is, how is this going to be configured? And I know that was part of the conversation that you all having, and how is it going to be implemented? So we're looking forward to being at the table when you're having that conversation, but also as they come up with the plan for how it's going to happen, if it's going to happen. So again, thank you for the opportunity. We are here to serve in whatever capacity you need us to serve in terms of resource, but also just being at the table as well. Thank you very much.
Great, thank you.
The next speaker is Pastor Omar Medina.
Well, good afternoon. Thank you, Council President Armand Budish, distinguished members of the Cuyahoga County Council, staff, and other elected and appointed representatives. My name is Pastor Omar. I proudly serve as the president of the United Hispanic Pastors Association, whose membership is representative of community-based Hispanic churches throughout Cuyahoga County, but it's also enriched by members from Lorain, Lucas, and Franklin counties as well. I am here today on behalf of and as a member of the Hispanic Alliance, an organization that enhances the collective impact of Hispanic serving agencies throughout the region. While the Hispanic Alliance is relatively new, our community-based membership can boast over 280 years of collective experience and wisdom from providing services to the region's growing Latino population. We are here today to bring to your attention the potentially dangerous impact that the proposed budget reductions can have on hundreds of Latino residents served by our member agencies on a daily basis. Although we recognize and support any requirement of ongoing fiduciary oversight and responsibility, we also understand and witness all too frequently the devastation on the lives of children and families when safety net services are cut. Historically, our member agencies have continually been called upon to do more with less. We address the serious issues of limited funding and other resources by working harder, longer, and more efficiently. And although we pride ourselves on being Hispanic serving, not one of our members ever denies services to non-Hispanics. Our impact is felt far and wide, benefiting all who come to our doors, regardless of race, ethnicity, religious beliefs, or sexual orientation. My time's up? Okay, thank you.
Thank you. Has anyone else signed in?
Yes, Mr. Chair. Megan Bonham? Excuse me, Megan, will you hit the button, please?
I'm sorry. Good afternoon, Council. I wanted to introduce myself. My name is Megan Bonham. I am the new Assistant Executive Director of the Metanoia Project. My predecessor, Tim Walters, had a relationship with some of you in the past. We've been supported by this council in the past for the past 2 budget cycles, and we would like to ask for your continued support during this budget cycle. What we are is a hospitality center. We offer hospitality services overnight to homeless men and women in Cleveland. That is a unique feature of our hospitality center, that we offer our services to both men and women. Something else that is quite distinct about us is that we target our services at homeless men and women that are living outside on park benches and alleys, or in other unstable conditions. What we do is when the weather gets cold, we open our doors and invite people inside, give them a warm meal, offer them a place to rest and some trusting relationships. And we go out and outreach into communities to find people to bring inside. Last winter, we were open 107 nights, and on average, we welcomed about 100 people inside. Those nights included Thanksgiving and Christmas Eve and Christmas Day. I think we can all remember how cold it is in Cleveland in the wintertime, and we would like to continue to have your support in this budget cycle. We have been awarded $25,000 in the past, and we would like to continue to request that same $25,000. That's all.
Thank you.
The final person who has signed in to speak is Nicole DeBose.
Good afternoon, Council. My name is Nicole DeBose. I am the Director of the OSU Extension Office in Cuyahoga County. On behalf of The Ohio State University, I would like to thank you for your generous support of the Cuyahoga County office and ask for your consideration in not reducing our budget so we may continue to meet the growing demand of our programming and services. Currently, we serve over 26,000 youth and families. Thank you.
Thank you. Is that it? Great,
Yes,
thank you.
Mr. Chair.
Okay, so this afternoon, we're actually going to pick up, and I appreciate Mr. Merriman's flexibility. Unfortunately, he's bending more to accommodate us to come back this afternoon. This session will close out the Health and Human Services section of our budget hearing with the exception of the Adams Board of Metro Health. This afternoon, we'll hear from Job and Family Services, Office of Homeless Services, Early Childhood, Invest in Children, Family and Children First Council, the Office of Reentry, and the Department of Workforce Development. So we have a lot on our plate this afternoon, and I appreciate Council's flexibility, but also I'd like us all to just be mindful of the time we have. Mr. Merriman, if you please come forward.
Good afternoon, David Merriman, Cuyahoga Job and Family Services. I'm here on behalf of our organization to present the budget, and I have had a chance to speak with the other directors that are scheduled for this afternoon. They asked that you please save your tough questions for them, and that that I move quickly through my presentation.
Just pull up a chair. You can sit right next to me.
There we go. So the mission of Cuyahoga Job and Family Services is to promote economic self-sufficiency, personal responsibility for families by providing a broad range of quality services. And at the heart of what we do is we are the public assistance system for all of Cuyahoga County, and we provide residents the cash, food, childcare, Medicaid assistance that they're eligible for, as well as the child support services. Before I can get into what we are doing and how we do it, I would like to just make one correction. I think as the budget book was presented, frequently there are terms used that are budgetary terms, and I know that the budget book references the Child Support Enforcement Agency. You'll please excuse me that as I present this, if I talk about the Office of Child Support Services, I mean that organization. It's important that I recognize that because our Office of Child Support Services has really endeavored to change the culture of its organization by focusing more on supporting families, supporting obligors and obligees, and by increasing its ability to meet people where they are and to support their service needs. And so, if I refer to OCSS, I'm talking about CISA. We are most likely the largest human service provider in the state of Ohio. We serve over 260,000 families. We have 126,000 households that are receiving, over 260,000 households. We have 126,000 households receiving child support services. And we have been providing Medicaid recently to about 295,000 individuals. And so we have a significant reach. We are in every single community in this county, and I would wager that we touch on just about every family in one form or another. So we are the county's human service network, and it is a great work that we do. Excuse me. So how are we able to do this? How are we able to reach this many people? Our system starts with our staff. I believe we have the most flexible and most committed staff in the entire county. Our eligibility specialists, our child support officers, and then the supervisors and the other staff that support them have been exceptionally flexible over the past 2 years. They have taken on significant policy changes from the federal government. They have begun to change the culture of their own systems by implementing behavioral interventions. They have been asked to do double data entry for some of our statewide systems, and yet they do, and they continue to perform. We all recognize there is always room for improvement in the work that we do, but I can't begin my presentation without thanking the support workers, the eligibility specialists, the customer service aides that really get this work done, and they are exceptional. What else do we do? We are using performance-based contracts for all of our purchased services, and these are the model for much of the rest of human services. Bob Math in our workforce service unit has created an excellent model for creating contracts that both establish a basic rate to enable the agency to operate, and then they heavily utilize performance measures to provide payment. And that has enabled us to right-size services, to expand contracts that are effective, and reconsider whether or not we continue a specific program or a contractor. The last area that I'll touch on is IT. We are trying to use information technology whenever possible to reach people in their home. And historically, our model has been focused on a face-to-face interaction, and we are designed to make those interactions occur in as many communities as we can be located in, and in some situations in a coordinated fashion with Division of Children and Family Services or the Ohio Means Jobs Cleveland-Cuyahoga County office. But as our model evolves, we will be having more reliance on technology. And ultimately, I think this is to the benefit of the clients because it will enable them to access services in their home. I think that's important. We recognize there are transportation barriers that prevent many people from coming and seeing us. People have busy schedules, and they are frequently stacking appointments on appointments. And so whenever possible, we will be utilizing technology to enroll and to sustain cases. And our hope is that in the coming year or two, we will be a model for technology utilization. I think the last area that I would like to just very briefly touch on is our use of innovative programs. Everything from our earned income tax credit, our use of behavioral interventions, and then our Office of Child Support Services employer child support training programs. I think each of these programs has found ways in which it can improve the quality of the services that it offers and to really provide a value to the community. So in the interest of time, I'll stop there, and I'll see if you have any questions.
Great. Any questions from members of the committee? Ms. Simon?
Thank you. I wanted to follow up on something I heard you say with regard to CISA, Office of Child Support Services, and how perhaps there's an evolution where now that department will meet people where they are and transact business differently. What do you mean by that?
So there are a couple things that we're doing differently. So one of the things that we've begun to do is we have started to do regular trainings with employers. We recognize that this is one of the best strategies that we can employ is to have our employers be aware of the requirements and have access to our system.
You're the employers in the county who administer the garnishment of wages?
That's correct.
Okay.
Our partners in that. And so that's one thing that we do. Another thing, we've begun to cross-train staff so that if our call center has a number of staff that are off in a day, we can now pull people from other parts of the building to ensure that we have at least a minimum staffing and we can answer calls as quickly as they come in. And those calls come in both from the families that have engaged us as clients, as well as employers that have questions about their obligations. Those are two areas. The other things that we're doing, we have been working with a national evaluation firm to examine our notification, the communications that we send to people's houses. All too frequently, they are very legalistic, and they have a very high level of literacy to understand what is being communicated to them. By working with an organization called MDRC, we've piloted a redesign of our forms so that they will be easier to read, easier to understanding, and probably most importantly, they'll be less officious. They will not be the county wagging its finger at someone starting the conversation with, this is what you owe, this is your arrearage. It will be, here are ways for you to provide your payment. Here are avenues for you to reach out to us to reconsider the existing orders.
So does that in part explain the increase in professional services line and the contracts that went up for CISA contracts? What part of this engagement of this consultant?
So the increase in the professional service line, I'm going to pull it up. So are you referring to the increase of $4 million to $6 million? So that is actually our contracts with the courts.
All court.
Yeah, so these are the contracts that we provide to the court to be our partners in we cover their costs for hearings. So that's the increase.
So you draw down from federal funds for child support services, is it for 4D?
4D, yeah.
4D. And so those funds will support employees to answer the phones and service the clients of the county.
That's correct.
So when you start to cross-train these other,
There are other employees within the Office of Child Support. And so in our Office of Child Support, we have an establishment division as well as an enforcement division. And so at this point, our enforcement division has largely been working on the phones. We're going to start cross-training our establishment division so we can have more people that are able to use the phone systems, and we can always ensure a certain level of coverage of phones.
okay, that's it for now, Mr. Chair.
Okay, thank you. Any other questions? Mr. Jones? And Mr. Miller?
Director Merriman, your county expenditures draw down federal funding for the services that you have within your agency. Now that we are significantly reducing those expenditures, is the county at risk of losing any federal funding?
We are not. We draw down based upon our utilization of the service. And the reductions that we've put forward are based upon overcapacity and grants. They're not services that we are providing, and we don't need to have the contracts in place. If we're not providing a service to a constituent, to a customer, then there is no drawdown to receive.
In the recommended budget, there is a line item that says that there are additional revenues for capital repairs in the neighborhood of $2 million and an estimated cost over a 2-year period. What are those capital repairs?
There are several, the most significant of which is the redesign of our front door. I think our county executive, Armin Budish, has talked a bit about the challenge and I'm just going to say the poor planning and the design of our building, that it had 2 separate front doors. And I think we all are not satisfied with of being required to tell a member of the public that walks in our building from Superior Avenue to see benefits, and if it's the middle of winter or it's the middle of a storm, telling them they have to leave and walk around the front. And so Armin has budgeted, among other things, for us to redesign our front door so every person can walk into our building off of Payne Avenue and get to any part of the building.
And you've taken me on a tour through the building, so I know what you're referring to. It's weird to have to walk into CISA on one side and have to physically go back outside, walk around to come in to the other department. So it certainly is a need. Is there a dollar amount at this point for what the cost would be to make this change?
Not at this time. We have engaged an architect. He is developing plans and proposals for us. We've had several meetings. We've had some revisions, and so there's not a final figure at this time.
When do you expect to have that figure?
I believe it will be available by the end of the year.
By the end of the year. The other concern, the concern that I have is anything above what you're discussing, you're looking to draw, according to the book, to be covered by the PA reserves. Now, the public assistance, I assume that is public assistance, correct?
It's public assistance.
Public assistance are funds that we've used for human services, and I would say not traditionally for capital improvements, even though it's a human service department. I have a concern around that, the use of PA funds for things that aren't direct services, human services into the community, and targeted towards capital improvement.
I'm sorry, do you have a question on that?
And maybe the question isn't for you,
Okay.
but I just want to throw that out there.
Well, it is my understanding that human service levies dollars are not to be used for capital improvements. And so I do think we inevitably get charged back for any capital improvements we make. And, and our source of funding is the PA.
Well, maybe, Mr. Jones, the direct question to Mr. Triozzi is, are PEA funds in a permissible use for capital improvements?
Mr. Chair, I'll report back to you. I understand the question.
Okay. Madam Clerk, if you'll note that. Thank you.
My belief at this moment is it's not. It cannot.
Calling Walter Parfiowitz.
PA reserves, can be used for capital improvements.
Because they are now unencumbered? When they
No,
were originally-
PA reserves are monies that we've drawn down already in advance. We can use those for capital improvements. We'll just have to charge them to the state and federal governments as depreciation.
They were dollars that were originally helping human service dollars in various departments that went unused, and
They're not unused. We've expensed them, we've drawn them down.
they were unused when they were initially dedicated to a health and human service purpose. And when those dollars were not used in that cycle, then they went into the PA fund.
They remain in the PA fund, correct?
They're in the PA fund.
Right.
And then my question is, now that they're in the PA fund, do they somehow legally become unencumbered? And
They're county funds at that point. We're free to do with them what we want, just as long as it's a health and human service purpose.
And my question is, capital improvement of the Virgil Brown building a health and human service purpose?
Correct.
That's my question.
Yeah, and we can use it for that purpose.
Okay.
We cannot use levy funds for capital improvements. That's written
See,
into
that's why I
the,
come back to it, because they are Health and Human Service funds. The PA fund is only a fund that we dump our HHS dollars into after they were not used for an original purpose.
Yeah, and on this matter, I think maybe it'd be best for us to provide clarification on uses of the levy funds. It's my understanding there's language in the levy ordinance that restricts its use. And so how about if we provide that to you and give you that justification?
That'll be fine.
Thank you. Mr. Miller, then Mr. Gallagher.
Mr. Chairman, Director, first of all, I got to say that you have a huge tiger by the tail with this department, so I commend you being willing to take this on and your good service.
Thank you.
My question is regarding the $500,000 listed as a reduction item for various Ohio Works First contracts, and I'm wondering if you could tell us a little bit more about that and whether it has any service implications.
It does not have any service implications. I'm sorry, should I refer to the, okay, so to the councilman. It does not have any service implications. Our Work First service group does performance-based contracting. They understand how many clients can be served out of our services. And over the past 2 years, we've had less clients come to us receiving to receive cash assistance. The state refers to this as Ohio Works First. One of the programs that is an eligible service for Ohio Works First is Job Search, Job Readiness. Individuals that come seeking a job, come seeking cash assistance, we can send them to a provider to do Job Search, Job Readiness services. We had 2 providers that were providing that service over the past 2 years. Because there has been less clients coming to us for cash assistance, we now feel we can get by with 1 provider. They have the capacity to serve that entire population. So we will serve every single person that comes to us and requests that form of service out of that 1 provider instead of 2.
And Director, these 2 contracts, were they on an annual basis or were they per client served?
They're on an annual basis, and we procured them for 1 year with 2 one-year extensions, and we are subject to do a future procurement on them.
Okay, fine, thank you.
All right, I believe Ms. Simon has a question, but I'll ask my questions as soon as she gets back. So you stated earlier that you perceive there being a transportation issue insofar as the delivery of service. Did you state?
Transportation it tends to be a barrier for all human services. Many people do not live in direct proximity to service providers, and if they have no resources, if they're living in poverty, they may not be able to quickly get to that service center or get around the county network of services.
So with the reduction of 2 service centers, Southgate and West Shore, how does that impact, if we already acknowledge that there's a transportation issue and folks seeking services getting those services, how by the reduction of 2 service centers does that make the situation better?
No, we are shifting our service model to focus more on the use of the internet. When an individual goes online and they complete an ohiobenefits.com application, they actually open themselves up to doing passive renewal, which would enable them to not have to go anywhere for some services. Additionally, we're working with the state to implement voice signature so that when a person calls us, we can capture their application and capture their signature through the phone. And our intention is to have more of those services available to the community. The state has already established a contact center that it is doing voice signature for Medicaid. And in this way, people don't have to go to any one of the neighborhood family service centers. They can access all of those services through the internet or through the phone. And most of our clients, if not nearly all of them, have a phone.
So there is the acknowledgement that 2 service centers are being closed.
We are looking to
that's just a
come
yes or
out
no.
of 2 service centers as 2 leases as neighborhood family service centers. We still may use some of that space for other purposes within the county, but we currently have 5 neighborhood family service centers. One of those is located at Virgil Brown. 4 of them are in the community. We think we can provide the same quality of service out of 2 neighborhood family service centers in Virgil Brown.
So you are shutting 2 down?
As neighborhood service centers.
as
yes.
neighborhood service centers, with the expectation that the population that takes advantage of those services is web accessible
Or has a phone.
or
Yeah.
has a phone? Okay. Well, I'll tell you what, I'll defer my remaining questions, and Ms. Simon had a question.
Mr. Hairston, do you have a question? Go ahead. Just a question about the, I don't understand what a reduced cooperative agreement is with the courts. You're reducing that in, what's a cooperative agreement with the courts?
So the courts, we cover the cost of the courts to utilize their staff, and in the same way that DCFS covers the cost of courts for their hearings.
You're talking about 4D money being administered through your department to
Yes.
cover those employees and.
Yeah, so,
and-
in the past, the courts were provided resources and they billed 4D. Right now, the county will have the resources. We will provide the courts the full revenue that they need to provide their operations. And so when we refer our clients to them, they can see them and they can serve them. We will draw down 4D funds.
Why is that happening instead of the courts administering this money?
Well, this is, I think as we look at our expenses, we feel like we have the same ability to do federal drawdown as the courts. And I think this is a service that we also do at DCFS and we do in other areas. And so this is just, I think, a more consistent model.
I'm not sure, though, that you have the expertise to know the ins and outs of day-to-day court activity and what's needed over there. That's, you're looking at this purely as an administrative function, but at the end of the day, it's about how best to serve the clients of the county. And the courts are day-to-day in the trenches with these customers. And so I just wanted to tell you that that's a concern of mine, that I'm hearing about this.
We're not changing the court service model in any way, and we are going to provide them full funding for the services that we enter into a cooperative agreement with them for. All we're doing, this is a budgetary matter. This is how the funds are drawn down.
Are you going to do that with the prosecutor's office?
Yeah, so that's already set up. That's one of the cooperative agreements that we also have.
Okay, I want to look further into this. Thanks.
Okay. Mr. Jones, then Mr. Germain.
Director, what accounts for the Southgate lease reduction?
So that lease was scheduled to end in this year. We extended it 9 months, and we don't intend to extend it any further. So we will have a part of our staff in Southgate for a part of next year. We expect to be out of that facility by 2017.
Are there any costs built into the budget for the moving of this or any other moves?
When we move, we utilize Public Works, and Public Works does a chargeback to us, but we tend to be able to cover those out of the budget we currently have.
Okay. Thank you.
Okay, Mr. Germain.
Thank you. Mr. Merriman, in reducing these locations and going to phone and internet, have you measured what the customer satisfaction rate is?
So, Councilman, we do a customer satisfaction survey, and I should have recognized there was a time that we had more neighborhood family service centers. There was a time we had neighborhood family service centers in Ohio City and Clark Fulton. We were opening them in Collinwood. We were opening them all over. But I think as our client base changed, we have been contracting for some time, and our customer service, at least as a response to our customer satisfaction surveys, has stayed consistent. I would recognize that our biggest customer service area for growth is our ability to quickly respond to phone calls and to engage people. We feel that a better investment of our resources would be in technology that enables people to get through to us quickly, to have their questions answered, and for them not to have to come and sit down and do a face-to-face interview with us.
Okay, thank you. Mr. Hairston.
Thank you, Mr. Chair. You mentioned that the fact that people have phones at home would kind of take up the slack for the centers that may close. Where are we in that process? I believe the state has to apply with the federal government, with the waiver, and talk to me about the process and where
Absolutely.
we're along with that. Because you and I have had discussions
Yes.
about the fact the food bank would like to institute that also as they help people who come to their doors.
Yeah, and to the councilman, yes, thank you very much. We have had those conversations. The requirement is for the state of Ohio to request a waiver to the federal government before it can implement voice signature for food assistance. The state of Ohio has requested that, and we continue to push the state to follow through and to get that waiver in hand. This is possibly the most transformative component of our services. If we can get voice signature, then our service model used to be one where twice a year a person receiving food assistance would have to come into our building, register, sit down, do an interview, do our checklist. We would recertify them, and they would go on with their day. What this new voice signature will allow us to do is to do that exact same thing over the phone. Twice a year, we'll have a phone conversation. We'll read to them the assurances and their requirements. At the end of it, we'll click save, and we will have recorded that visit and provided them the continuation of their eligibility. We are simply waiting on the federal government and then the state to implement that policy, but it is our full intention to go after it.
Have they given, appreciate the response, have they given some sort of timeline? Has the feds communicated? I know they move at their own pace, but have the feds communicated back with the state about where they are in that process?
The state has not, and when I met with the director last Friday, it was my first agenda item. And I continue to just pester them, to move that along, because this is transformative. If we can have a person pick up the phone and call us, and we're changing all of our phone structure so that we can start to do that.
As a place, as a tool to use in place of closing centers, but we don't have an indication of when that'll be up and running.
We don't. But the state has begun to do voice signature, voice application, and passive renewal for Medicaid. And that's the area we've had our greatest expansion of services. A person can call the state's 1-800 number right now. They'll get a live person on the other end of the phone, and that person will take their application, and through that phone conversation will complete their application. If the individual is eligible and they agree to allow the state to do passive renewal, the state will actually tick the box in the system that will say every year they're going to go and they're going to have, they're going to, in an automated fashion, check against all the databases to see if the person's circumstances have changed. If they have not, that person will be eligible for Medicaid for another year. That, to me, is an efficient system, and that's something to work towards.
Okay, thank you. Ms. Brown and Ms. Conwell.
Thank you. Councilman Harrison asked and answered my question, one of the questions that I had. I guess the concern that I have with closing the centers, do they offer some type of testing obligation for people that are seeking employment, or?
To the councilwoman, the Southgate Center as well as West Shore are both collaborative partners with us and Ohio Means Jobs, and so there are OMJ sites located in those buildings. But Ohio Means Jobs is, I know they're going to be speaking later today, so I shouldn't talk about their strategic direction, although I am on the board. And they're increasingly moving to a system where they're trying to get their participants to use the web as well. And I think as they serve more and more young people, that's possible. We all recognize there is a digital divide. We have to find strategies to have everyone be able to get access as well as to know how to use the computers. And so those centers are still there, but the Ohio Means Jobs will still have one-stop operations just around the corner in Boulevard, and then they have other locations as well.
Well, the concern is not so much the digital divide, but when you're looking at a population that is poverty-stricken, internet access is not something that they can always afford. So that is a concern where this facility is something where that tool can be housed for them to gain employment, and now we're taking that away. It's a little unsettling.
I should also recognize there has been a recent policy change that is looking to provide internet access at a very low cost for people that are eligible for food assistance. That's a program that's been announced. We don't have the rules on it yet, but the figure that I saw was something like $10 a month to be able to give people that are eligible for food assistance internet access. So we're working with that coalition, and we're going to hope to see where that program goes. I have to say that I think we need to do more around internet access. I've had that conversation with Councilwoman Conwell. I think we all recognize more commerce is occurring on the internet as well as training, and this is how Ohio Means Jobs is utilizing its its job board. It posts all of its jobs on its website, and people that have the ability to manage their account can be drawing down jobs all through their electronic system. And I think that system is great. It's efficient. It's not going to be for everyone, and so there will always need to be a place for someone to go and sit down face to face with someone.
Before Ms. Conwell, just to follow up to that, you said there was a policy change regarding internet access and providing funding. Policy change from whom?
So I believe this is a new program that's being offered through one of the major phone carriers in our area and cable carriers. I'd be happy to get the specifics on who the author is.
Yeah, Ms. Conwell.
Through the chair to Mr. Merriman, going back to the closing of the 2 neighborhood centers, is there presently a transition plan for the employees that work in these 2 neighborhood centers that will be phased out?
So to the councilman, to be clear, there will be no layoffs. We're not transitioning anyone out of county employment. We need as many good staff as we can get, and we've got some great ones out there. So we are not contracting our staff as a result of this. We're simply going to be moving them into other offices. We have not created the transition plan yet. We have looked at our space. I got to tell you, as I've walked around our buildings, I've seen a lot of open desks. Our buildings were largely designed prior to the last ERIP, and we had more FTEs. And I think as we move to technology, we can be more efficient. And as we move to things like passive renewal, our hope is that we can see people and we can spend more time with them, but it doesn't require as many individual face-to-face interactions.
Okay, and just on that point, and that was my whole thing, no layoffs.
No layoffs.
I never heard that term. I figured they would be phased into other buildings. Can you there's been many county departments in our different moves that we recently had several times. Can you give the families or the employees at least a 6 months notice if they're going to be moved to another site? That's childcare. That's a lot that they have to juggle. I would just ask that the administration really pays attention to that. There's been so many employees that have been moved before and been impacted on that and had to change their life around. So 6 months seems like it's reasonable to let them know which site that you've identified they will go to. Second question would be the files at these sites. How will they be stored?
Great question. So our files are a significant issue for us. We have a floor at the Halley Building. I think you might have toured it before. We have 26,000 square feet of files that are old. No new files have gone in there in any significant fashion since 2002. So I'm looking back to see if Arnell is still here. So we have actually been working on a new initiative where we are going to be using some of our clients to begin to go through our files and help separate what can be stored and what can be eliminated. We just, in the past 45 days, got a ruling from the Ohio Records Commission that our old files that don't have investigative matters can be destroyed. This is great news for us. We want to go through, purge files that are historical, they're dated, where they're no longer active. There is just a lot of them. And so we feel there's a way for us to do this by utilizing clients that are actually coming to the county and are doing apprenticeships and internships with us, have them go through the stacks, help us clear it. One, get rid of the dated materials, follow the Ohio Records Commission policy, and 2, get us out of yet another lease. So we're working on it. And whatever we decide, we will decide for those centers as well.
And I'd just like to go on record. Can you keep once you decide how many files it's determined how many needs to be destroyed and how many needs to go to the Halley Building, can you keep this council
Sure.
updated on that?
Well, they're already at the Halley. Most of our files are already at the Halley
Halley
Building,
Building.
and so we occasionally pull files out of it for active cases, and so the files would most likely be staying there. Just about everything else we do is on OnBase. We utilize OnBase as our content management system, and we have for years. So most of our records are actually stored in OnBase. So staff may have files at their desks. They may be on the cases they're working on at that moment, that week, maybe that month, but most likely not. The goal is always to get the information into OnBase so that it can be used throughout the system and then is stored electronically.
Okay, and the one site that you're closing, you said the West Shore, where's that located? Is that the one on 93rd and Lorraine?
Yes, I think it's 98th.
And so my question to that, since it is the 93rd and Lorraine, I figured the Southgate, that's a shopping plaza. It's easy to find some retail in that spot, but since any collaborations with the city councilman regarding the reuse plan for this building? I used to live over there. I know once it was a grocery store, it had turned into something else. It's on the corner,
Yeah.
and it's in a retail block, and it's going to leave some blight. So I just want to know if you have some conversations with
Well,
going forward on how that would be used.
And to clarify, I believe it is 98th and Lorraine. I don't think it's 93rd, so it's the same area though.
I'm still trying to.
All right.
Did you get an answer? So have you talked to the councilman?
I have not talked to the council. We have not, on both of those, it's still the budget process, and so we're not, you know.
Well, just enlighten them that this
Sure.
is a plan
Okay.
that we're planning on doing, and
Ms. Brown?
Point, just I want to piggyback off of Councilwoman Conwell. We're in the same position by we, I mean, Councilman Jones and I, that Northfield corridor has been slowly declining, and this will only add to the decline. So contrary to the thought that because it's a shopping plaza and it might be easy to find retail space, that simply is not the case. So I do hope you intend to work with another struggling community, which is Maple Heights, which Councilman Jones represents, and I represent the other side of the street, Bedford Heights, to consider reaching out to try to prevent that blight and continuous decline of the community.
All right, thank you. Mr. Jones?
Okay. One of the key performance measures of your department is the work participation rate. So for every 2 individuals who get cash assistance from you, at least one of those persons should have gainful employment and training. 50%, that's your target. Okay. In 2014, we had 34%. In fact, I'll go back. When I took office, we were at 20%. So we constantly talked about it, pushed, had meetings with directors of the past, and we're at 34%, but we're still woefully under the 50% target. So for 2015, you're estimating to get to 45%, and you're targeting 50% by 2017. Speak a little bit to what has moved the needle, how you expect to move the needle to reach what I think is probably the most key performance measure in your entire department.
Well, you know, I agree with you and I disagree with you. I think it is key in the eyes of the state, but it is changing and it's going to be key for a different reason. First, I'd like to speak
It's key to me because it puts people to work.
Well, and I think you'll be excited to hear what I'm going to share on this point. So what have we done? We've cleaned up our denominator. That's really that's the way that everybody has gone after this rate. Largely, that means we've gone through and we've seen people that haven't been giving us the right hours, or they haven't been giving us any hours, and we sanction them and we move them off the benefit. And in that way, we've gone from serving thousands to serving around 1,500 families. And so that's the process. That's how just about everybody goes after changing the rate. You know, I got to say, I'm a part of that. I'm a part of the group that's pursued that aggressively because it was a requirement of the federal government. The state took it very seriously, and we took it very seriously as the state's partner. What's changed, though, is very important. So the state of Ohio has recently requested a waiver of the federal government to completely reconsider work participation. We are still going to be committed to achieving 50%, but I think we're going to be more in line with your vision and say that this should be more about jobs, and this should be more about meaningful activities, not simply chasing a rate. Because frequently what happens when you chase the rate is you look to push people off the service, and you know, maybe they're marginal, maybe they're close. Well, if you are just going after the rates, that's your problem, that's not mine. And that is less of what we want to be doing. And I can illustrate that. Sometimes there are months we can look at our performance and we can see dips. And a lot of times we look at them and we know that they're right when people are coming out of college. They're going into a summer break. They're going into a Christmas break. That college is counted towards achieving the rates, and they're off for 3 weeks. Well, if they don't know the right sort of hours and that right minutes, the rate drops. We are not pushing to kick them off the benefit. We want to engage them. We want to help them get through college. So the state's waiver is a request. This is the Ohio Department of Job and Family Services to the federal government requesting that we will still pursue the 50%, but we will be less focused on core and not core. Let me tell you what that means. Depending on how many children you have and how old they are, you may have to do 20 hours a week of certain activities and another 10 hours of another activity. And we go over that with you, but it gets pretty confusing quickly. One of the things the state is requesting is it's 30 hours, and that whatever activities you choose meet all of your requirements. That's the first. The second is education is, and I'm sorry, Councilman Jones knows this very well, so this is more general education. Education is what I think one of the most important things we can be offering a person. I mean, we know that a person gets a BA, they have a proven wage increase. And yet, when you go on public assistance, your education can count towards your first year on public assistance, but not your second or third. If you want to keep going to college at that point, that's great. That's on you. You still have to go volunteer 30 hours a week somewhere. And that creates a disincentive. People tend to drop out of college, or they have to now manage 30 hours a week somewhere, plus full-time college, plus being a parent. So the state has requested to waive that component so a person can stay in college for 3 years. I think that's great. The third thing is that individuals, and it's college as well as other forms of education, and I think that's important too, because it could be vocational education. The third area is, right now, people can have 16 hours of good cause in a month. And that means if you don't make the rate, you can apply for good cause to say that, I had a death, I had an illness, but you get 80 in a year. But if you ever go over 16 in a certain month, then anything else that you do doesn't count, and we now have to look at sanctioning you. And the state is saying, just have it be 80 for the year. Set aside the 16 month. If any of us have ever had a sick kid, 16 hours, you spend 4 days in the hospital, that's your 16 hours. You still have to bring that child home. You still got to care for him the rest of the week. And so you're going to be put in a choice of doing, sending your child somewhere or staying at home and caring for your child. So the state has recently requested a waiver to the federal government asking for these programs restrictions to change. So I support this waiver. I think it makes a lot of sense. What's even more interesting is it's at a time that the federal government is considering reauthoring TANF completely. And there's now bipartisan support to reconsider this entire policy. There's now bipartisan support to say this separation between activities does not make sense for most families. And most states have gamed the rate. They've done whatever strategy they have to do to meet the rate. And so it was a long answer to your question of what are we doing? We are doing things right now to help us meet the rate, but we're all tracking what the state and the federal government want, which is a change of the policy.
Last question. You have a new workforce development service planned. Do you expect that to have an impact on the participation rate? And just explain a little bit, what will this service be?
Significant impact. I mean, we're going to prioritize meaningful employment, and we're going to prioritize a long-term relationship with clients.
Interject, is this the $3 million per
Yes.
year? The executive and I have agreed to defer discussion on that until a formal plan is
Okay.
presented. Okay. All right, thank you. Any other questions? I have a couple questions real quick. The reduction of these two service centers, one of the responses was other uses are being considered that would draw additional revenue. We talk about subletting those spaces out. Is that what that answer is implying?
No, to the chair, no. I think our intent is to look and see if there's other county uses. So it's a great space and it's a great area. We're too diffuse. We're spread out too far. So we're looking to see if there's other county uses.
There was the discussion, one of my colleagues asked about moving expenses, and you said you'd use Public Works. Well, obviously, there's an internal charge for that.
Mm-hmm.
You acknowledge that there was no budget line for the internal service cost of moving, that you would find it within other areas. As I understand this budget, it's basically being cut to basically previous year's actuals. If it's based on previous year's actuals, then aren't you going to anticipate it going over budget the minute that these costs hit?
We've not gone over budget with any of our public works charges, and I think if we have to look at our public works plan and we have to see ways for us to move dollars around, we will, but we will stay within our budget.
Okay, famous words. And the last item, I believe there was a question regarding the redesign and rebuild of the entry of Virgil Brown, correct?
Yeah.
Did I hear that no true cost estimate has been conducted at this time, that you're anticipating an analysis to come forward in the future?
We've had several conversations. I've seen a range of options that cost hundreds to cost millions. And, I think we don't have enough information on any of them to be able to come up with an accurate number at this time.
So what is the amount that's in the budget?
It's probably a better question for Michael Dever, because I think he's working with us and they're managing that contract.
But it is in your budget because it's the use of PA funds, right?
Yeah, but it would ultimately be managed by Public Works. And so let me confirm that with the director.
All right, if the clerk will make note of that. The reason it's important is because it's a drawdown on PA reserves, and we want to understand what that impact is, especially in this budget. All right, thank you. Any other questions? Thank you, Mr. Merriman. Thanks for your patience today.
It's our pleasure. Thank you.
All right, next on the agenda is Ruth Gillette, the Office of Homeless Services.
Good afternoon, council and members and chair.
And before you begin, I want to thank you for the cookies. Ruth brought us cookies today. They're here, so we'll pass them around.
And I want to be very clear that they were not purchased with levy dollars or general fund.
And not intended to sway a position.
Absolutely not. No, I feel sorry for you, actually, having to go through this process. So.
And no rap for us this year, as 6 years ago?
No. I had a song last year about sequestration, but I was sort of discouraged from presenting it, and I didn't bring it this year, so.
Okay, well, thank you.
Something to look forward to for next year. So to the chair and council members, thank you for this opportunity to discuss the Office of Homeless Services budget. The mission of the Office of Homeless Services is to reduce and end homelessness in our community. This is pursued through planning and policy development with stakeholders, including homeless and formerly homeless persons, by developing resources to implement strategic initiatives, and by tracking outcomes so that efforts can be improved to achieve the desired objectives. Health and Human Service levy support is used to provide a basic safety net of emergency shelter services for single adults in our community. 90% of the OHS contract budget line funded overnight shelter capacity for 600 single men, 180 single women, and overflow capacity for families 365 days a year. Providing this safety net has reduced street homelessness and has enabled very long-term homeless persons to be linked with appropriate behavioral and physical health services and permanent housing. The remaining 10% of levy contract funds are used to support activities that reduce the length of time that families with children experience homelessness through rapid rehousing. The number of households served and the reduction in shelter length of stay are monitored on a quarterly basis. The OHS does not have any new initiatives or policy changes to share with council at this time. The proposed budget maintains funding for existing activities at the 2015 level, and the OHS personnel remain at 5 people. No additional funding requests have been submitted. I'm happy to answer any questions that you have.
Okay, any questions for the director? Mr. Miller.
Mr. Chairman, Director, thanks very much for your long and capable service in this area. And my question, I know that that some of the council initiatives did not get retained in the budget, and so I just want to make clear it says that there were no reductions. Does this mean that the $25,000 for the Metanoia project that we funded in the last 3 or 4 years is in the budget for 2016 and 2017?
Through the chair to Councilman Miller, that is my understanding, yes.
Okay, thank you.
Thank you. If I can ask staff just to verify that, and just get back to us. I'm looking at Mr. McAleer. Thank you. Any other questions? So I have one question. And this goes to the philosophy and strategy as to how this budget was compiled was using the 2015 base budget as the foundation and build from or subtract from that. Council, based on the need within the community, appropriated an additional $200,000 for rapid rehousing, which was not originally included in this budget. However, there's a note in the response that says it will be added back as part of amendments to the executive recommended budget. That was a response from the administration, so I would like to know, maybe this is to Mr. Glassburn, who is making that amendment and what other amendments are going to be added to the budget?
Mr. Chairman, there were a handful of items in this process where we requested that OBM include an item or not include an item where the item did not end up in the proper status. This is one of those items. It was our intention to include the 200,000. It was not. We're making an inventory of all of those items as we go along, and we will present a balanced request once we have completed that list.
Okay, so then this item is being, the $200,000 for rapid rehousing is included in the budget. It's not presented here, but the intent of the administration is to restore that funding.
It is our intention to restore those funds and then to find a corresponding offset to pay for that additional expense.
So in the budget right now, where it's showing a deficit or a reduction in homeless services, that'll actually be of $176,000, if I'm reading that correctly. That'll actually be an increase.
It'll be a modest increase because of the 2% wage inclusion and the hospitalization inclusions.
Okay, so to take note, $200,000 will be added to the budget for rapid rehousing.
Thank you. It's been my understanding that that will in fact happen.
Okay.
So thank you.
Very good. Any further questions?
I just wanted to follow up with that, with Mr. Glassburn. I heard you say that this will be restored, but there'll be a corresponding reduction someplace else? Did I hear that?
Yes, the general fund and the levy funds as introduced have very narrow surplus margins in them at this time, so any changes would require an identification of a new, either an offsetting cut or a new revenue source to prevent us from going into a negative situation.
Well, perhaps. Okay, I just wanted to be clear. So we've had a lot of talk about, if I can, Mr. Chair, about the women's shelter and overcrowding, and council members, including me, have been approached about the conditions, and I know you're aware of that. And with this current budget, address those needs, or how are those needs being addressed, and as it relates to this budget secondarily?
Through the chair to Councilwoman Simon, Councilwoman Conwell and myself and several staff from the agencies did visit the women's shelter to look at the issue of additional beds to accommodate people who've been sleeping on mats. And for less than $30,000, you'd be able to purchase additional bunk beds and mattresses. And I believe that the councilwoman with the administrator is pursuing asking for some donations of beds and mattresses to meet that need in the very short term.
Thank you.
Mm-hmm.
So that number's 30,000.
It was 23 to 30,000,
Okay.
something like that.
Okay, thank you. Right, sure. All right, thank you. Any further questions?
I just have
Mr. Jones.
And Ruth, you heard the whole conversation we had earlier about the public assistance fund. I mean, there's about $60 million in this fund. But from your department's perspective, the majority, over 90% of your money comes from Health and Human Services. If there are some unused dollars, do they stay in your department, or do some of those actually go to the PA fund?
Through the chair to Councilman Jones, the budget contract line that I have is very specific.
Okay.
We spend the money every year. We contract with the contract line amount. There's never any money left over. So I guess the answer would be, not that I'm aware of, that anything is.
Okay, thank you.
All right, thank you. Okay, yes, Mr. Brady.
Thank you, and good to see you again, Ruth Gillette. We've been becoming more and more familiar with your issues over the last 5 years and have done at least more than one visit to several of the locations, including yours. I certainly don't have any objection and welcome any contributions anybody wants to make to help with the homeless center in terms of something like less than $30,000 for beds. But I don't want to leave it there. I mean, if we're talking about a budget, the scale of this, and we're looking for people to donate money so that we can have enough beds for the homeless center, I don't think how a county the size of this county would be operating like that. And so, you know, if somebody wants to step up and help, I'm all for that. But let's identify it. Otherwise, it's going to be identified in this budget for sure.
And if I can, to that point, and that's why I'm focusing on this $60 million in this PA fund. It's almost an indictment on the county to have funds of dollars, which I envision as being health and human service related, not capital improvement. We'll see what the law department says after they review it. But again, to that point, asking the community to donate when we have dollars that are for that purpose. So I just wanted to echo what President has said.
To the chair, to Councilman Brady and Jones, and I mentioned this to Councilwoman Conwell the other day, that because the amount is so relatively small, our community was able to apply for capital dollars this past year through Ohio Housing Finance Agency. The county was able to receive a $1.9 million grant to do improvements to 2100 Lakeside, which is a building that the county owns. Eden, took the initiative and applied for capital dollars to make improvements at the women's shelter. I was going to have a conversation with the director of Eden to see if within those state funds and local matching dollars, they might be able to come up with these resources immediately as well. So I can report back to you on that.
All right, thank you. Anything else? Okay. Would you like some cookies?
No, thank you.
Okay,
They're
very
for
good.
you.
Thank
you very much.
Thank you. Next on the agenda is Early Childhood Invest in Children, Dr. Rebecca Dorman.
Thanks. Too much sugar. Good afternoon. Thank you very much. I really regret that due to the hearings, you were unable to attend our annual meeting this morning, which was wonderful, but we did miss you all. As you said, I'm representing Invest in Children, the Office of Early Childhood. Our mission is to mobilize resources and energy to ensure the well-being of all young children in Cuyahoga County, provide supportive services to parents and caregivers, build awareness, momentum, and advocacy in the community around children and family issues. During the next 2 years that the budget covers, Invest in Children will continue to provide its comprehensive continuum of services from the prenatal period to kindergarten via our lead agencies and the many community-based partner agencies. We serve over 7,000 children and their families directly, and we serve many thousands more indirectly as we work to improve the quality of childcare throughout the community. We also continue to enhance our current programs and innovate. I'm proud to say right now, technology is playing a big role in all of that. We'll give you very quick bullet points. We've redesigned the computer system for our Welcome Home Newborn Home Visit program, which is allowing the assignment of cases to our nurses who go out and visit our Medicaid families much more quickly and efficiently to get them out to see the new moms and babies faster. In our early childhood mental health program, we've instituted a new measure of outcome to help us track impact better, and we're doing it with an online system that'll let us pull electronic reports on a real-time basis. In our home visiting program, Bright Beginnings, we have a new social media staff person who is engaging, providing resources in between home visits to families, as well as doing in-person parent groups. And then with some private dollars we've been able to raise, we are meeting parents where they are on their smartphones. And we are creating a school readiness app to give them real-time resources, such as when's the story time in my local library, is there high-quality preschool in my neighborhood, et cetera. And we are getting survey data directly from families, as well as doing focus groups with parents to make sure we're developing an app that families will want to use. We know they've told us they want it. We want to make sure we design it the way they want it to be designed. We're launching Ready Rosie, which is a new family engagement component in universal pre-K. That was the focus of our annual meeting this morning, where there are 2-minute videos showing positive parent behavior with their own child, get delivered daily to families to see an actual model of what does positive parent-child engagement look like in real-world settings. Obviously, I'm happy to tell you about all of that. And also just wanted to mention we're partnering with the Children's Museum, which you may be aware is moving to a new headquarters in the old mansion on Euclid, right next to DCFS, helping design a parent resource center as families come into the building. That was something they hadn't thought about, and we have a great partnership there. So that just gives you a little bit of what's going on in our program. Now, specifically to relate to the budget, the new expenditure policy and a change in our budget is for SPARK, Supporting Partnerships to Assure Ready Kids. There's an additional $250,000 identified in the budget. This program provides home-based services to preschoolers and their parents. It's helping kids get school ready, really helping parents be better at supporting their children. So the parents are school ready and the children are school ready. A lot of research data on the program, actually tracking the kids even up through 5th grade to show that the impact of having these home visits in the year before starting school has a long-lasting effect as kids get into school. So that is our new expenditure. The $250,000 will allow us to serve 100 families. We'll put the dollars to use on both the east and west sides of the city, as well as in one high-need suburb. So we plan to serve 20 families who children would attend Marion Sterling School in the central neighborhood, 40 families at the Clark School, Clark Fulton, and 40 families in Warrensville Heights. So I can take a breath and pause, and before I go on, would you like me to keep going, or would you rather ask questions about Spark?
Why don't you just continue?
Keep going? Okay. On the reduction side of our budget, there's a $341,000 reduction to the Family Child Care Home System program. This reduction comes at a time when we are adjusting the program, which provides training and technical assistance to providers to enhance quality. There are currently 697 licensed family child care homes in the county. They care for over 3,600 children. The Family Child Care System program is led by Starting Point, our regional resource and referral agency on child care, and our lead agency on all things related to child care. So in the past, we had focused on families being in our Gold Seal program, which is a program developed by Invest in Children many years ago, because the state quality rating system did not exist at that point. And in fact, even though it's existed now for a number of years, it's only since July of 14 that family child care providers were able to access the system. But now, with this change, so that these providers can access Step Up to Quality, we're transitioning and leaving behind the Gold Seal program, which we had developed, and instead moving to encourage providers to access and get into Step Up to Quality. The reason that that is so important is that by 2020, the state of Ohio has mandated that all childcare providers, whether they're home providers or centers, if you receive any public dollars, and in this case, we're really, for these providers, talking about what we used to call vouchers or childcare subsidies for low-income families. So if you're a provider that receives those kinds of funds, you must be rated and step up to quality by 2020 in order to receive those funds. So there is a bit of a ticking clock here for us to move all of those 697 providers into step up to quality. So that is where the focus is going to be. We have about 100 right now who have either been rated or who are on track to be rated, have registered in the system. So doing the math on that, that leaves us with 600 and 4 years to get it done. So our goal is to do 150 a year to get there and meet that deadline. We believe that retooling the program to do that is possible to do with the 341,000 reduction. So some of the costs that were associated with us maintaining our own rating system are going away, and we will focus really on getting providers into the state rating system. There will be some reductions in 2 contracts. I think you have the detail there to 2 of the subcontracting agencies. For the homes, there's sort of a trade-off financially. So if you achieve a gold seal with Invest in Children, which meant that we rated you, we had independent people rate you, and you were rated high on a national rating instrument, you received a $500 sort of reward or bonus, you could call it incentive. So that will no longer happen because the Gold Seal program will be gone. But Step Up to Quality providers do get additional funding through the state. So once these providers are rated, they do get a financial benefit from being there, both in terms of a annual amount, which is, if you're a 1-star provider, $400, plus I think it's $25 a child, plus your rate is higher. It's 5% higher on the low end. So dollars and cents wise, the providers in the long term will actually have more funding as a result of being a Step Up to Quality provider rather than a Gold Seal provider. So that is the reduction in terms of program funding. In terms of personnel, right now we have 2 vacant positions we're hoping to fill. The Social Program Administrator 2 position, we're working with PRC, moving along with that. Then we had a fiscal staff person that was a full FTE. What we think would be effective in this area is for us to share that position with our friends down the hall, Family Child First Council. We think we're both really serving the continuum of children. We're located next to each other on the same floor over in Courthouse Square. And we think by doing that, we can both have save the county some money and also sort of help the offices collaborate more effectively. So we're comfortable with small savings there, and that's our budget.
Okay, great. Well, thank you. I've got Ms. Conwell, Mr. Gallagher, and Ms. Simon.
Through the chair to director, first question would be, and when you're talking about the licensed home providers, who is paying for our licensed home providers' new state rating? Are we paying for that?
By paying for
the
it,
Step Up for Quality.
That's a system that's open to them. There are costs to a provider that would get them ready for that, like they would need to have a curriculum, et cetera, et cetera. Actually, that's what they use some of our incentive money to do, might be to help them prepare to get into the system, but they're not charged for being rated.
Okay, so that's a free thing.
Yes.
Because the Gold Seal went away. the state has revamped and said, now you got to get this certification. So I just wanted to make sure. It
Right.
wasn't a
We were
cost.
the only county, just to clarify, so this was an Invest in Children thing. We felt it was important when we started 16 years ago to work with family child care homes. We felt we needed a real emphasis on enhancing quality, and this was the vehicle that was created here. So we were ahead of the state, as usual, in doing that. So, but now that the state has stepped up, clearly, and now that there's this mandate that you have to be in the system to access the publicly funded kids, clearly we need to shift providers over.
So why wouldn't they have both, the step up to quality and the golden seal?
Economy of scale, there's really, we don't want to make it onerous for providers, and clearly the bigger stake for them is to be able to take publicly funded kids. So we want to funnel them into that system.
Okay, and currently the providers that need to still be rated, because you said you're going to try 150 a year, is that going to impact them in any way of receiving any vouchers or things of that nature? Will they be allowed to operate if while they're in between this process?
Until 2020, they will be able to operate without being rated, but beginning in 2020, they will need to be rated in order to accept those kids.
Okay, and one of our council questions was, why is the 10 million in funding for universal pre-kindergarten not included in the Invest in Children budget? So my question was, is the new from your perspective, is the new universal pre-K program to replace Invest in Children?
My understanding is that our current UPK program is going to stay intact. You know, we just started our 3-year funding cycle, and that's going to stay intact, and all the other funding that comes to Invest in Children will still be there, and this is on top of. Everything I've heard is this is in addition to the current investment.
Okay, well, I have lots of questions, and I'm sure a lot of council do on that. Number 2, could you provide council with the breakdown of where the dollars are distributed for our current Head Start program now between CEOGC and the centers?
In terms of Head Start funding, okay.
In terms of which sites are funded, CEOGC currently has a contract of $500,000 from us.
Yes, that's the Lewis Stokes Head Start site.
Okay, so
And
it's
then
only one, it only goes to one site?
So COGC for the first time this cycle is a UPK provider, but it is an awfully big site, 362 kids and a $500,000 a year contract. So it's one site, but a lot of kids.
Okay. And what about, well, we still want this in a paper format, and the centers, they get $1.1 to $2 million for less slots.
Bob's right. I don't have that at my fingertips, but my.
That's okay. Director, you can.
Do you want to
Yeah.
get, you get you that? We have the breakdown of all that, yeah.
And we don't need to read them individually. If we can just get the report, a copy of the
Sure,
report through the
yeah,
clerk.
we have a whole list. We'll just get it to you so you can see those numbers. Okay, sure.
Okay, that's my questions
Those are
for
yours.
now. I'll come back.
Okay.
All right, Mr. Gallagher.
At the start of the budget process, what did your 10% reduction look like?
1.1 million was the 10%.
And what did you take out?
I eliminated the entire family child care system and 2 other child care and another smaller all around child care system, not touching UPK. But that all came back, except we did think that we could manage the 341,000 reduction without harming the system.
How'd that come back?
I think that there was discussion and the realization that we didn't want to undermine the system that we were creating and that UPK sits on, and that the new program, the new expanded $10 million program would sit on, that we needed the infrastructure to stay in place.
Do you have an idea what this new expanded program is going to look like? Because we don't.
My understanding is that there's going to be another hearing where Sharon Sobel Jordan will be coming back with more details to tell you and answer.
Have you been briefed on that, or have you been asked about that? Because I think one of the questions is, why aren't you handling that?
I'm in those conversations now, yes.
I guess we'll have to wait for the opening. Thank you.
Ms. Simon.
Thank you. Universal Pre-K has two ways to access, one by which is the scholarship program, and the other is there's eligibility for children
Correct.
in the county. Do you have the numbers for how many kids or children are served at that eligibility level?
So we know from the past that about 75% of the children in the program will receive scholarships, which means under 400% of poverty. What we've instituted this year to build in more accountability for the scholarship is, while we asked providers in the past to keep income eligibility information in the files in the center, and then we would audit. Now, before we will award the dollars, they're sending paperwork to us with a signature from the parent verifying income with all the documents. And we are gathering that now. And one of the things we did want to look at was what percent are under 200, 300, 400% of poverty. So we have some of that data right now, but we're still getting it in for the new year, but we will have that.
Where are these children residing? Throughout the county?
Throughout the county.
Throughout the
Correct.
county. And what happens as that percentage reduces? Does that diminish the families throughout the county where they live in terms of children served and who will be eligible?
Well, UPK was predicated on making, on the one hand, making it a high-quality system and making it affordable for middle and low-income families, but also making it accessible to everybody. So right now, anyone can go to a UPK program. It's just you must meet the income eligibility to get the scholarship. So the other kids get all the same services, I think, if that's what, as the kids with scholarships. Every kid in a site is considered a UPK child, and they get everything the same. Some families get the scholarship assistance.
Now, if you had additional dollars and invest in children, would that enable this universal pre-K to become more universal? As my colleague, Mr. Germano, always brings up, that would be the goal. That's the aspiration. So would dollars enable us to become more
Yes.
closer to
Right.
universal?
Absolutely. I mean, as we expanded in the past, when we got additional dollars in the prior administration, we have a bigger pot when we do our RFP process and bring more providers on. So we now have about 2,300 children in, which is a significant increase from the past. So we've continued to grow. We started at 1,000 kids 9 years ago, and as additional funds become available, we've added sites and added kids.
And one last question about private investment or partnerships. That was the original plan, and you actually formed these relationships as private and public partnerships from the inception of Invest in Children. Is that true?
True. Since our inception, we've had $26 million of private funding supporting us, in addition to the $212 million in public dollars. Currently, our UPK program is supported by a 2-year, $500,000 grant from the Gund Foundation, which helps us provide more services. And that was preceded by a $1 million grant over 3 years from the Gund Foundation, who's been very generous in supporting UPK.
Thank you.
Thank you. Mr. Jones.
Director, my question is again around the 10 million funding that's not passing through your department. You said you are part of those conversations now. Your department is Invest in Children has gotten national recognition. That's probably fair to say. My question is, well, let me start by saying how I'm thinking, so you can maybe better understand my question. If I go back into the previous administration, and I'll use demolition as an example. There was a $50 million demolition plan, and it was to be implemented by our Department of Development. We looked at that and we said, well, there's a better council, there's a better backbone organization that could help us to be more effective. That was the County Land Bank. So we reintroduced the legislation where the County Land Bank helped us, and it is working well now because they were well recognized in this arena. As effective as our own internal department was, the Land Bank was helped us to do this more effectively. I say in the reverse, in this instance, you are a respected organization or department that is in the trenches, and you've already gone through the list of the relationships and the services that you provided to this community. You say you've been in the meetings, or at least in the meetings now. My concern and question really is, what is that backbone organization that's going to facilitate this $10 million if it's not your department? Have you been told yet what that backbone organization will be?
We're having some meetings actually next week to talk further because we know that's really important. You've asked some really, I think, very good questions, and we want to bring you good answers. So I think we're going to come back to you with answers in November.
Let me just, I don't want to keep belaboring the point, but this program, as well as the infant mortality and the workforce program, the bread's not baked yet. There are no answers.
And I
so
say
when
this-
we ask, unfortunately, when we ask directors, like the questions you're asking, which are valid questions, they don't have the answers either because the administration has yet to complete their analysis of what the program's going to look like.
Understood. But for me, there's a difference between the infant mortality, which is proposed at $1 million and or less maybe.
I understand.
And a $10 million program.
The directors just don't have the answers because the information's not been disseminated from the executive's office yet. And I don't want to put the directors in an awkward position to answer questions. They just don't have the information to provide.
Thank you.
Mr. Sharon?
Not intended to be an awkward question, to be a pretty straightforward question. Do you have administrative staff doing this function currently to help in the universal pre-K program today?
UPK is actually the one program that we administer directly with providers because there was a feeling that it was important. It's our flagship, and we needed direct accountability. So we have the direct contracts with all of those providers.
So the answer is you already have administrative staff monitoring service providers.
We do a big piece of that, and we partner with Starting Point to do other pieces of it, yes.
Okay. And so more dollars might include a little bit more administration, but would it, if you had more dollars to provide a wider breadth of service, would it double your staff? Or could you reasonably add more dollars in service support without necessarily starting from scratch and putting together a whole new functional department?
I think we would need to build on what we've got. I do think we would probably need some more staff. It really would depend exactly if the payment structure would be similar. We have a pretty intense scrutiny right now, the way we do our payments. We get enrollment every month from a computerized system because we're paying only if the children are enrolled, et cetera, et cetera. So if we would keep the level of accountability, which is pretty high that we've got, I would say we would need some additional help and just have to see how it played out exactly.
Pretend that you're back at square one and you haven't delivered service one. Have you learned some lessons over this time, and have you gained and become a stronger organization as a result of what you've done?
How could I say no to that?
Of course. These are designed to be yes questions. They were designed to be short yes questions too, because it just seems to me that we're reinventing the wheel, and I've always found it's easier to stand up a growth organization than it is to stand up a brand new organization.
I will say, because I mentioned we have 2 vacant positions, and the other vacant position is actually the staff position that is really primarily responsible for UPK. And so with her not being here and we haven't hired yet, I've become that person with help, and our other staff have stepped up too. And it's really, I've gotten into the weeds now for the past number of months, even more than I've ever been on UPK, having to perform that function. And I'm continually impressed by the design of the program. I was not one of the designers. I inherited it in its second year. But it was a very robust community planning process that created it, and now I think I've learned to respect it even more. I mean, it's not easy to do this work, and I think the folks who got together and came up with the plan did a great job with it. So yes, there are ways to improve it, but I think it's very solid in its basic underpinnings. I will say that you may have noticed in the when Sharon Sobel Jordan presented and she lined up the programs, UPK, Pre-for-CLE, and the new program, which is still being designed, many of the key parts of UPK are still being preserved. So I think we've seen that it works, and it's a question of what next.
I can't speak for my colleagues, but I hope when you get in that room, you speak with a loud voice. Thank you.
Thank you.
Thank you. Ms. Brown.
With respect to your request, I'll yield many of the questions that I had, but I just want to be clear. The proposed funding is to start a new UPK program. We're just clear on that. It's not an expansion of what currently exists.
I think it shares many of the elements of the current model, but I think there's appeared to be some differences too, and we'll be back soon to give you more details.
Okay, and then the last thing that I wanted to address is that I kind of got the feeling that there's some people that have some valuable insights, such as Dr. Chisholm, that could be at the table. Who is at the table discussing the parameters and the development of this program?
We've had there's been the Educational Service Center and Pre-for-CLE, the Gund Foundation, PNC, and in addition, we had an all-day retreat with a national consultant with a number of providers, and I know COGC was invited, and I don't think anyone was able to come that day. I know Thea couldn't come, but they were invited. The other Head Start grantee and some other UPK providers, a couple school districts were there for that all-day retreat to sort of really dive in and get more on-the-ground feedback.
All right, thank you. Ms. Conwell.
Through the chair to the director, I just want to go back. You stated you wanted to add new sites. Were you talking about universal pre-K sites?
I'm not.
I don't know. You stated that you wanted to add new sites, and I just wanted to know what the cost would be. You were talking about universal pre-K.
I'm not. I don't.
Question, whether if there were additional dollars, whether we could expand the sites for universal pre-K, I think.
And of course, yeah.
Okay. And I just want to piggyback on Councilwoman Brown's, I think it was a lack of communication because the communication didn't get to all the players at the table that should be talking about universal pre-K in Cuyahoga County. I just want to understand the dynamics. When you talk about, because I don't think I'm clear, when you talk about Invest in Children has universal pre-K, is that the 1,800 slots that the centers have, or is that something separate?
The
slots, meaning the slots for the children.
So the centers is one provider with I think 6 sites in UPK of our 34. So they have sites. Catholic Charities has sites. Guidestone has sites. COGC has the one site. And then there are a lot of smaller providers throughout the county who are also UPK providers.
How many slots do we have for Invest
It's
in
about
Children?
2,300 right now. It's just a matter of who's enrolled at a given point in time. 34 sites and 2,300 kids.
Okay, so I know that you can't answer, but if you, like I stated, I was piggybacking off of Councilwoman Brown. If you could bring back, or when you go to the meeting, to address some of our questions, will this be an expansion of the existing Head Start program, a plan to provide resources allowing the capacity to do more for your site as well as CEOG sites, things that are already existing? Why are we creating something new? It's a cost, it's a startup cost for that. And just some of the data that I've collected, because it currently, I don't know how far this 10 million can go, because it currently takes roughly 26 to 27 million to serve 3,000 Head Start slots. So 10 million is like a drop in the bucket to that. So if you could just take those questions
Yeah, and that's why I think.
to that meeting.
I don't mean to keep belaboring the point. Nobody has the answers because the program is not developed, period. And so in order for us to be able to address it and either appropriate or encumber or put a demand on reserves, we've got to understand what the program is. Unfortunately, the director just is not in a position to answer those questions. Okay, Mr. Brady?
Yeah, just very quickly, you mentioned that, unless I missed, which is possible, you had an all-day retreat recently, and you mentioned that a national consultant, as you explained it. And I don't know if you said who that was, and I didn't catch it, but I'd like to know who the national consultant is. Been this private meeting, developing county.
She was from Build, and can you help me with her? Pardon? It was Build. Right, do you remember her name? Jerry Cobb from the Build Initiative. Build is a national group that works on building early childhood systems.
Okay, thank you.
Okay, Mr. Hairston.
Thank you. Just really quick, Mr. Chair, thank you, Rebecca, for the information. You mentioned that maybe there was communication issue with Dr. Chisholm for not being a part of that meeting.
No, they just had a conflict that day. They were invited.
But just an administration, they are the oldest, and they've been doing this for a very, very long time. And they serve the population that most need this universal pre-K or this pre-K education, and it's Blacks and Hispanics. So I'm asking administration, because she is here and she's in my district, their hub, for you all to have a discussion with her and get her engaged in that conversation from this day on. Thank you.
Okay, great. I have two questions. So in the responses to the questions that we sent, there was you may have answered this, the $341,000 reduction in funding, a reconfigured program will result in these two community agencies providing less technical assistance and receiving subcontracts from Starting Point with lower values. What does that mean with lower values?
$100,000. We anticipate $100,000 reduction from each of those contracts.
So do you anticipate a reduction in services as a result of the reduction in?
Yes, but the services are associated with the Gold Seal program. So again, we're really trying to take advantage of the state doing sort of some of the work for us by having its own rating system. So the concomitant costs related to signing people up to be Gold Seal, monitoring them, assessing them, all of that, that's what goes away and the state essentially does all that for us now.
Okay. The other question I have has to do with a statement. It says the impact of these changes, this is the next paragraph regarding child care homes. The impact of these charges result in approximately 223 family child care providers no longer receiving targeted training, technical assistance. Well, that, once again, same question. I'm trying to identify with these reductions in the budget, what the ultimate impact is to those receiving services.
Absolutely.
Will there be a reduction in services?
So those 223 are Gold Seal providers. So the extra training, technical assistance that went into, first, you have to assess the home using a standardized assessment, the FITCRS. So there's a cost to that. Then you provide targeted training and technical assistance. You come back, you do another assessment. All that was to be in the Gold Seal program. And to get the Gold Seal, you have to attain that. So all of that part of the work is what is being reduced. And instead, we're working to get folks into Step Up to Quality and to be rated that way. So if you want more detail, I would call Billy Osborne Fears up to the microphone.
I'm just asking,
Okay.
if you're saying there's no reduction in services, then
I would say it's a streamline and a focus that I think we feel that we're at a time where it should happen, There's a bit of having to really push people to get rated now, quite honestly. It's a big deal for child care providers, so I don't want to minimize that, but we really want all the focus to be on doing that. So, yeah.
All right, thank you. Ms. Conlon.
What's the difference, through the chair, what's the difference between the gold seal, the criteria between the gold seal and the step up to quality?
Sure. So the Gold Seal, again, is something we created, homegrown in our county. We use a nationally recognized assessment, and you have to get a score of 5 out of 7 on that assessment, which an independent assessor does, and then another assessor comes in to make sure that that's correct for reliability. The step-up to rating system is a very complicated, I can't summarize it that easily. There are a number of things. There's a whole grid that the state does. I will throw in, though, that we're extremely proud that one of our UPK sites, and of course a former Gold Seal provider, was the first 5-star family child care provider in the state of Ohio. So we're really proud of that. So I think no one thought that was something that people thought was not quite possible this early in the game. So we're really proud of all the work that has come before. But where we're headed now is to be in step up to quality.
Okay, so I'm kind of confused because I thought earlier you stated that the step up to quality was something that we started.
No, that's the state of Ohio.
Okay.
We started Gold Seal.
Okay. And so was that, we were the only county that had the gold seal?
Mm-hmm.
Okay, but the state has been moving toward
Right.
step up to quality, but you kind of stated that we were ahead of that game.
Yes, we were.
So we noticed that, and what you're saying is that we started getting our providers licensed or ever how they did. I would really like to know, really be informed about the step up to quality. I know you guys came out some years back, to Councilman Jones and I, and explained the difference in all those programs and the star ratings and all that, and we
Right.
really had a full presentation to understand it and ask questions.
Sure.
So I would ask that would be another future HHS committee meeting.
Sure.
So we can understand the step up to quality, especially now before the universal pre-K.
Thank you. We'd love to do it.
Ms. Brown.
Just to piggyback off of that point, is it possible that a provider could have both? I guess that might be some of the confusion. You could qualify for the Gold Star as well as step up to quality.
You could have over the past year, but now that we're phasing it out, it would not be relevant anymore.
Okay,
Right.
all right.
Yes,
And
sure.
The Gold program, was that just for home providers or was that?
Yes,
for,
that was just for our home providers.
Okay, all right, thank you. And the step up to quality is for both home
For both.
and
Right,
centers?
correct. Centers were in, and actually now public school districts as well.
Okay, thank you.
Great. I don't believe there are any more questions. I want to thank you.
Sure.
And thank you for this information and follow up. I believe there's some information was
Yes,
requested.
I think we've noted it. We'll get that to you as soon as possible. Thank you very much.
Thank you.
Quick one-word question.
Yeah. Ms. Dorn.
Rebecca?
Director.
Director Dorn. What is the actual age range for your Department of Children?
We're prenatal to kindergarten.
Prenatal to kindergarten.
We actually support the Moms First program with some additional dollars that you heard about, which focuses on reducing infant mortality. That's the prenatal part. And then we end with March into Kindergarten, which is a campaign that we do with a lot of partners, including Family and Children First Council, which we're about to hear from, to get kids registered on time for kindergarten.
So they pick up at the next age, right?
We pass the baton, just like I'm about to do.
All right.
Okay, thank you.
So with that lead in, Family and Children's First Council, Robin Martin.
Good morning. Good afternoon.
Good afternoon.
My ears were burning this morning. My name came up a couple times. To the chairman, the president, and the council, good afternoon. I'm here to talk about Family and Children First Council. We are the policy and planning entity. We convene stakeholders.
A little more closely to the
I'm sorry.
microphone. That's okay.
We are the policy and planning entity. We convene stakeholders from child-serving, public, private, and nonprofit entities across Cuyahoga County. By law, we are charged with service coordination, which is a navigation system that helps parents who are experiencing problems and delays in service delivery, and child well-being, which we support with county funding to plan, develop, support, and implement prevention services for school-aged children and youth, kindergarten through graduation. Some of our new initiatives, I'm going to highlight 3 new initiatives that we rolled out in 2015. Closing the Achievement Gap. Closing the Achievement Gap operates in 4 inner-ring suburban school districts. It provides intensive support to 9th graders who are struggling academically and who are at risk of dropping out of school. Studies show that when students get past the 9th grade, they are less likely to drop out. Our top 4 metrics that we plan to look at or are looking at right now are academic improvement, increased school attendance, reduced suspension, and improved classroom behavior. We will gauge our success by measuring the number of youth that will matriculate to the 10th grade, graduation rates, and post-secondary achievement. So far, teachers have told us that they've noticed a 70% improvement in academic achievement and a 78% improvement in classroom behavior. Our second initiative that I would like to talk about is Children of Incarcerated Parents. This is an initiative that looks at the effects of trauma on children who have witnessed their parents being taken into police custody. We are currently in the planning phase, and we are conducting an inventory of existing services and identifying service gaps and barriers. The committee recently broke into subcommittees to develop plans related to corrections, prevention services, services for caregivers, police, and we're going to make a recommendation next week to add a component for youth voice. We intend to recommend several community-wide policy changes related to youth and families served in Cuyahoga County. And one example of that, we've spoken to programs that are currently operating in San Francisco and Allegheny County, and one of the initiatives they've been able to implement is a conversation between their public systems and their police departments on how arrests are handled when children are present. So we want to look at some of those types of policy changes as we move forward. Finally, the last initiative that I would like to talk about today is an enhancement of our service coordination system. We have been charged with doing service coordination for almost 20 years. However, we have, while it is in our mandate, we have received very little support from the state of Ohio to monitor it and to measure the outcomes of the program. So as a county entity, we have made a decision because they keep doing a start and stop with us. They will say, we're going to measure it this way, and we start the planning process, but it never comes to fruition. So we're going to move forward with our own process because they've done the stop and start on us about 3 or 4 times. What we're going to do is an enhancement to our current system. With the help of the Department of Information Technology, our department purchased a service coordination database. We are working with the Do It team, our system partners, to implement several program changes, which of course the database is part of that change, and we hope to launch it in December of this year. The metrics that we plan to look at, we want to have a system that tracks individual child and family plans, looking at benchmarks, outcomes, recidivism, service packages, trends, and costs. This will standardize the case flow just for the service coordination process. It would be similar to an electronic medical record. This is the first time, as I said earlier, in the history of service coordination that we've had an opportunity to actually look at the program at that level and be able to provide real-time information. We had a number of budget cuts, as you know, and so if it's okay with you all, I would rather stop there and go into the questions section, because I'm sure you have questions about some of our reductions, and we can address them one at a time if that's okay.
That sounds great.
Okay.
Questions?
Yes.
Okay, Mr. Miller.
My first question is if you could elaborate about the impact of the $500,000 reduction in the out-of-school time program, and is this a complete elimination or just a reduction? And my understanding is that out-of-school time programs are important to a number of things for youth, like closing the achievement gap, reduction in juvenile system involvement, youth development, reduction in gang violence, et cetera, and so so at first blush, this reduction looks discouraging. So I would like your input on it.
To the councilman, the reduction that you're referring to is $500,000 in a contract that right now is $1.4 million for out-of-school time across Cuyahoga County. At this point, we are still working with Starting Point. That is our lead agency for the contract to figure out what our next steps will be. We have an idea of the number of youth it will impact. We will have to change some of our processes and procedures. We did recently release a new RFP for out-of-school time over the summer, and more than likely what will happen is we will have to release a new RFP at the reduced rate.
Mr. Carroll is raising his hand to address this.
Do you mind? Excuse me, Mr. Chairman, Robin. To the councilman, I know this is the first of maybe a series of questions, and I'm referring to the council questions that we already have. As Chris mentioned before, he was referring to the Office of the Homeless Services budget, the $200,000, where that was clearly supposed to be included in the budget and was not. This is the reductions that Robin's program had to face or facing, and the materials you have, not in that exact same category, but I would say you've seen in all the budget prep materials, the 2-pagers, 3-pagers that you have, it says this reduction for this program was found through the overall human services cluster. So we looked at our 10% reduction throughout the cluster, and at times we're able to restore some by taking more out of others. I would say we would like to look at the reductions that Robin's program has been levied so far and see if there are other options and other ways it can be addressed. Because I think, as Robin says, she's looking at the implications of this particular cut that the councilman asked about. But we will be looking at other ways, as Chris also said, neutral ways to respond and potentially address some of these cuts. I just can't be too much more specific today. I think the point is, you can see there's a 32% reduction in the contract line in Robin's program. And I think we need to take a look at that and see what's possible if that could be addressed.
So is that interpretation that you're looking to restore the funding?
We're looking to, I think, have a fairer shake for this program, more in line with the kind of reductions that other people have had to take.
Okay, let me ask Mr. Glassburn, as these items come up, this one and the one in reentry, when do you envision getting back to council an amendment so we understand what you're looking at?
Mr. Chairman, we've not established a specific date yet. We are still trying to make sure that everything that we have proposed has the intended effect. As we continue in this process, I imagine that we will have more of those. We plan to share with you our intentions, but with limited staff, we're trying to do the best that we can to keep up with the requests as we get them.
Okay, all right, we'll make a note of this one. I'll look back to Mr. McAleer about this item as the previous item as a potential restoration. Any other questions? Mr. Jones.
Well, Director, as Director Dorman deals with birth to pre-K, you're dealing with our children from kindergarten through 12th grade.
Yes.
At the best assessment. Okay. I'm going to say this philosophically first. Okay. Our children, we're seeing in the news on a regular basis the loss of life of our children, to gun violence, to many other issues beyond that, and the support we provided at the county for our children from birth to 12th grade is meant to enhance our children, to strengthen them, to keep them on the right track. We do not run our city's school systems, but the county certainly is a support to the educational system, whether we're preparing them at pre-kindergarten, or whether we're preparing them at 9th to 12th grade. That is a role we can play. to any who would argue the county should not be involved in education. We are involved to that degree. The one thing I'm seeing use Councilman Strawn's point from a 50,000-foot level, I see an incredible dollar amount placed at the pre-kindergarten and earlier ages, and a smaller amount at those later years. If I had to make a comparison, I would say it's similar to people wanting to adopt a child, but as they get older, there's less interest in adopting the children as they get older. We see that same human nature pattern, I think, here. But if we are going to be successful, there needs to be more of a balance, I believe. Again, we're seeing tens and tens of millions in an area I truly support, pre-K, but similar dollars are not there at the older ages, and which is where your department comes in. So my first question really is, tell me the dollar amount that you have. Again, I think you just said it, the dollar amount that you've been reduced from your budget from the HHS. Is it simply 500,000 or is it greater than that?
No, our reduction was $1,206,556. $1,206,556. But let me say to that, we also had a revenue reduction in our state funding of $387,296. Many of you may or may not be familiar, at the state level, we receive funding from a program called Ohio Children's Trust Fund. At literally the very end of the previous state budget process, a new bill was introduced as a replacement law for the Ohio Children's Trust Fund. And as part of that replacement law, what the state decided to do was to stop designating a pot of funds to each individual county and to begin to designate that money from a regional basis. So after June 30th of 2016, we will no longer receive that $387,000 plus that's designated to Cuyahoga County. The only thing I know for sure about the upcoming process is that Cuyahoga County has been lumped in a region with Geauga County, Lake County, and Ashtabula. We have not received any specs on what the new program is going to look like. We have not been told any dollar amounts. The only thing we know is that if we are, as a region, going to submit any type of application, is due March 1st. I have a meeting set with the Family and Children First Council directors from the other 3 counties next week. Because we haven't been given the specs, I'm not sure what we're going to brainstorm, but I think we at least want to get on the same page about how our respective counties have used those dollars in the past, and to try to get ahead of the game as much as we can about recommendations we will have for a new application going forward.
Next question. Of the dollars that you just mentioned, how much of the reduction was from the HHS dollars? I know you mentioned state and others. How much was from our HHS dollars?
$687,296. $87,296.
Is that in the?
Go ahead, go right ahead.
On that point, is that in addition, is that included in the 1.2 from the
Yes.
county? Oh,
Yes.
okay.
Also in your budget, and I thank the executive for this part of adding $10,000 towards the evaluation of your CTAG.
Yes.
Of the CTAG program. Again, UPK is well documented. It's been evaluated. We know that these things work. In your age group, closer to 12th grade, we have $10,000 towards evaluation. Now, in the old government, a lot of times our directors, we were not should not be asking council for money. So I'm not going to ask you, I have no idea what has been said to you, but I will not ask you or any others what should be, what dollar amounts they would recommend.
Thank
But
you.
it's my belief, apart from other department director heads, that $10,000 is not a significant amount when I know what we have done for the evaluation of other programming. Again, this age group is important, and I will be looking to find out what a more accurate dollar amount, I believe, is a more effective dollar amount for the evaluation of a critical program. And so I just want to throw that out there. That's something I want to consider and look at. Okay, thank you.
Any other questions? I have a few. So I find it interesting that when we asked for questions and that we were told, we, the residents of the county, were told that the reductions would have no impact on service delivery. Yet, two of the responses to the questions says that one says the organization will do its best to minimize the impact on services, and the other says that your department will work with the providers to attempt to minimize the impact on service. So clearly, will be a reduction in services as a result of reduction in funding.
Yes.
If I've learned anything from Mr. Ivory and who's sitting here, or Mr. Jones, idle hands don't tend to get into trouble. Yet we're looking at reducing 25% youth internship programs. We're looking at reducing over 50% in parent services. We're looking at a 30% or greater reduction in teen pregnancy programming. These are all, we talk about, almost entry-level opportunities to continue to be in the Health and Human Service systems. Those seem to be three areas where we should not be focusing on reducing costs. I'm not saying increasing them, but clearly not reducing them, because those all seem to be opportunities to give people an opportunity to improve their current situation. And so I want us to look closely at those items as well, because clearly, intuitively, a reduction in any one of those services, let alone all of them, is a reduction. A reduction in funding is a reduction in services, which could have longer-lasting negative impacts on other services that we deliver. Because clearly, we don't want a reduction in funding here to require an increased funding in Mr. Vasquez's arena of reentry. So we need to spend a little time in understanding what that means holistically. Another question I have under the, where did he go? The Ohio State Extension Service, is that under your area as well?
Part of it, yes.
So the $25,000 reduction in their budget, which, as I understand, they were not consulted or conferred upon. It was just imposed upon them. What impact will that have on their service level?
Well, actually, that's the part that's not in the budget.
Okay, all right.
There's one item is a line item that goes to the Ohio State Extension, because their state office makes an agreement for all of their regional offices with their host counties in terms of a funding level for the host counties. And so the 20-some odd $1,000 that you just mentioned is part of their line item. For our office, they won an RFP for the youth engagement services, where they actually engage our young people around community conversations in terms of how they're feeling about services that are being offered in their communities, and just how they feel about just anything that they see as adults imposing on them. And so that contract was cut as part of our contract line, and it was more than the $22,000.
All right, thank you. Any other questions? Okay, hearing none, thank you. I appreciate your time. And if you have your prepared statement, your opening remarks, you can give to the clerk for the record.
Okay, thank you.
Okay, thank you. Next on the agenda, well, let me ask this. I see Mr. Vasquez getting up. If we could take a 5-minute recess and reconvene back at 3:15. Thank you.